Welcome, listener, to The Deep Dive. Today, we're getting into something really vital, something that affects pretty much everyone, cybersecurity and how data is handled in the NHS.
Yeah.
And what makes our source for this deep dive, well, really compelling, is the perspective. It's not just some cybersecurity pro looking from the outside in.
No, exactly.
This person has actually been a patient, extensively lived it from a hospital bed, quite literally.
Yeah, and that experience it's pretty stark. The author mentions, technically dying twice, spending 3 months recovering from sepsis right there on an NHS ward.
Wow.
So this isn't some abstract report. It's about seeing firsthand how these digital vulnerabilities, the tech issues, the security gaps, how they actually hit patient care, patient safety, and even the staff trying their best.
It makes it very real, doesn't it?
Absolutely. It comes from a place of genuine vulnerability makes the insights incredibly human.
So that's our mission today. We want to unpack these real-world cybersecurity challenges in the NHS using these, vivid examples from the author's own journey, and importantly, look at some constructive solutions, ones that might actually work with the reality of healthcare, on the ground. Okay, let's dive in. So let's start with the immediate stuff. The tangible effects. We know the NHS is critical, the staff are heroes, but it seems there's this growing problem. Outdated tech, fragmented systems, security that's just vulnerable.
Yeah, and it's really important to say, the author this isn't about bashing the NHS.
Right.
Everyone knows the staff are amazing, the resources are tight. It's more about these systemic cracks, They make the NHS a really big target for cybercriminals.
And how does that play out internally?
Well, one interesting point is that sometimes security concerns get routed weirdly, through clinical managers instead of straight to IT or security teams.
Okay. Just following procedure, maybe?
Yeah, existing processes. But it means things get missed or delayed. It frustrates the staff, and like the author saw, it can directly impact patient safety.
And the author gives some pretty jaw-dropping examples of this. What was one that really stood out?
Oh, the IWillHackYou Wi-Fi network. That's memorable.
Wait, what? IWillHackYou?
Yeah. So the author's there, recovering, sees this network pop up on their phone. First thought, hospitals being hacked.
I would think the same thing.
Right. But no, it turned out it was an agency staff member using their personal phone as a hotspot.
Why on earth would they do that?
Because the hospital Wi-Fi was too slow or too restrictive, and clinicians needed to get online, for patient notes, data transfer during their shift. Patient care comes first, right?
Of course.
So they find a workaround. But think about it. Every time they connect to that hotspot...
They're bypassing all the hospital security.
Exactly. No proper encryption, no oversight. Who knows where that data is going? And the author reported it.
Okay,
treated like business as usual. Just... wow, that flags a massive, massive hole right there.
That really paints a picture of the pressure, doesn't it? Staff forced into these compromises by slow systems. Does it go beyond Wi-Fi?
Oh, absolutely. Shadow IT is a big one. The author saw junior doctors taking photos of clinical records on their personal phones.
Because the official systems were too slow?
Yeah, or maybe a terminal wasn't free, but then that sensitive patient data... it's sitting on a personal phone, maybe syncing to their personal Google Drive or iCloud.
Oh, dear.
And NHS Digital, the NCSC, they know this is a major vulnerability across the board.
And there was another tech example, something about a tablet.
Ah, yes, the Remarkable 2 tablet. So the author's in this formal complaints meeting, and the facilities manager is taking notes on their personal Remarkable 2.
Okay. And the problem is?
Those devices, they usually sync automatically to cloud services, like personal Google Drive, Dropbox, whatever.
So sensitive clinical details from a complaints meeting
are potentially flowing straight into someone's unmanaged personal cloud account, completely outside NHS control or security.
And did anyone notice? Or care?
Apparently not. The author raised it, got blank stares, just no awareness of the risk. Or maybe just resignation. It really shows a gap in understanding, or perhaps just concern about where sensitive data actually goes. And what's really fascinating, if you connect to these stories, they show how, in that high-pressure world of healthcare, convenience just has to trump policy sometimes.
Yeah.
Staff aren't being malicious. They're just trying to deliver urgent care with the tools they have, or the tools they can make work.
That convenience point is so key. And it explains things like shared logins, right?
Mm-hmm.
And just dealing with slow systems day to day.
Yeah.
What did the author observe there?
Well, yeah, imagine logging into a system And it takes over a minute every single time. The software's clunky, the hardware feels ancient. So what happens? People leave machines logged in, they share passwords, or they just avoid the official system if they can find another way.
Makes sense, but risky.
Totally. And the author had this really poignant thought during their own critical moments. They were way more grateful for the clinician's skill with a defibrillator than their typing speed.
Understandable.
It really underlines why staff will always put the patient first, not the cumbersome tech.
Yeah, absolutely. But that gap between the policy and the reality, it leads to some, frankly, bizarre situations, like the CDs and taxes thing.
Oh, that one is just incredible. Really sums up the absurdity. So the author's late wife needed care, and an MRI scan from one hospital trust had to be burned onto a CD and sent 60 miles. By taxi.
By taxi. In this day and age?
In 2024, yes, because there was no secure way to send it electronically between the trusts.
But surely there are secure methods.
Of course. The author asked, why not SFTP? Why not modern standards like FHIR APIs? Just blank stares again. It's mind-boggling inefficiency and a huge security risk, too. What if that taxi crashes? What if the CD gets lost?
Unbelievable. And it's not just between hospitals, is it? Even within the same organization.
Right. The author noted that sometimes different departments within the same trust using the same software would create separate, totally incompatible patient records.
So you end up with, what, multiple versions of the patient's history?
Exactly. Duplicated info, different versions of the truth, and sometimes, the author says, the patient gets blamed when the system pulls up an old record from, say, 2022 instead of the current one. They have to correct the system's mistake.
That's awful.
Yeah.
And these workarounds, they spill over into basic communication, too. You mentioned privacy earlier.
Yeah, definitely. Things like staff calling out patient names and other details, like maybe date of birth across a busy waiting room anyone can overhear.
Right.
Or sending sensitive documents by email to personal accounts. Staff sometimes think basic email encryption like TLS is enough, but it isn't end-to-end secure.
They misunderstand the tech.
Often, yes. And trusts rely on these tiny email disclaimers no one reads. The author is actually challenging this with the Information Commissioner's Office, the ICO. It shows a real lack of understanding about basic data security on the ground floor.
And when these kinds of vulnerabilities, these systemic issues aren't tackled, that's when the big disasters happen, isn't it? We've seen major cyber attacks hit the NHS.
We certainly have. These are the cautionary tales. Remember WannaCry back in 2017?
Vaguely, yeah. That was ransomware.
Huge ransomware attack hit 47 NHS organizations, resulted in something like 19,000 canceled appointments, costed about $92 million to sort out.
Ouch. And more recently.
The Synnovis attack, just June 2024, they're a big pathology provider for London hospitals. Ransomware again, 400 gigabytes of data breached. Estimated cost, $32.7 million just from the disruption.
And wasn't there something even worse linked to that one?
There were reports linking a patient death to the disruption caused by that attack. It really brings home the potential severity.
So these aren't just IT problems. They have real-world, potentially fatal consequences. Are these isolated cases?
Sadly, no. There was NHS Dumfries and Galloway in March 2024. About 3 terabytes of patient and staff data leaked, published online.
3 terabytes?
Yep. And HCRG Care Group, February 2025, they handle NHS contracts. Over 50 terabytes exfiltrated by the Medusa ransomware gang. A $2 million ransom demand.
50 terabytes.
These aren't just blips. They show what happens when foundational IT isn't strong enough, when recovery plans aren't tested. They were preventable, really.
Okay, so that paints a pretty sobering picture.
Yeah.
But, as you said, the author isn't just here to list problems. They want to fix them.
Right.
And the key seems to be finding solutions that work with how healthcare actually operates, not against it.
Exactly. And the good thing is there is an official strategy, the government's cybersecurity strategy for health and adult social care running up to 2030. It has 5 pillars, a solid framework.
So the author's ideas fit into that.
Yeah, they align with it, but also build on it, particularly stressing this idea of a just culture for reporting incidents.
What does just culture mean here?
It means creating an environment where staff feel safe to flag problems, to report near misses or actual incidents without fearing they'll be blamed.
Because otherwise things just get hidden.
Precisely. You can't fix what you don't know about or what people are too scared to mention. It's absolutely vital for learning and improvement.
That makes total sense. So let's get into the specific recommendations. The author breaks them down by timeline. What about the quick wins? Things that could be done, like now.
Okay, quick wins. Simple stuff, really, like replacing those vague email disclaimers with really clear, practical guidance.
Instead of tiny print nobody reads.
Exactly. Or putting touchpads or kiosks in reception areas so patients can enter details privately instead of shouting them across the room.
Good idea.
And just generally raising awareness for patients, too, about their GDPR rights regarding their health data. Small changes, potentially big impact on privacy and building trust.
Okay, practical stuff. What about the short term, say the next year or two?
Short term, the focus is more on foundational security, things like mandating Cyber Essentials Plus certification for every single trust. It's a good baseline standard,
Right.
ensuring they have offline backups. And crucially, that those backups are tested regularly, essential for recovering from ransomware. And holding suppliers accountable, making sure they meet minimum security standards too, like Cyber Essentials or ISO 27001. Tighten the supply chain.
Okay, building stronger walls. Looking further out, medium term.
Medium term gets into tackling some of those ingrained bad habits, like implementing single sign-on solutions or virtual desktops.
To get rid of shared passwords.
Exactly. Make it easier and more secure for staff to log in individually. Also, finally adopting modern, secure ways to transfer data, SFTP, FHIR APIs to kill off the CDs and taxes absurdity once and for all.
Please.
And introducing public cyber resilience report cards for trusts.
Transparency.
Yeah, adds accountability, lets everyone see how trusts are doing, maybe drives improvement through comparison.
Interesting. And then the really big long-term stuff, the structural changes.
Long-term is about bigger investments in integration, things like properly resourcing and enhancing the central NHS Security Operations Center.
A central hub for monitoring.
Yeah, and a major program to upgrade all that outdated infrastructure that forces staff into risky shortcuts in the first place.
Tackling the root cause.
And, crucially, building what are called federated data models. Basically, secure ways to query data across different trusts without creating one giant vulnerable database. That would finally fix the problem of siloed patient records. Better care, better security.
This sounds like a really comprehensive plan, but the author still sees gaps, right? Even in the official strategy.
Yes, definitely. There are some critical omissions identified.
Like what?
A big one is patient-facing security. The official strategy is very focused on protecting the organization, but it kind of forgets about the patient's own digital literacy.
What do you mean?
Well, we're asking patients to use apps, portals, digital services more and more, but are we teaching them how to do that safely? Are we warning them about phishing scams targeting NHS users? The author argues strongly for public awareness campaigns about cyber risks for patients themselves.
That's a really good point. You can't just secure the hospital. You need to help the user too. What else is missing?
Physical security integration. It sounds basic, but the strategy is very digital focused. It overlooks those real-world security fails. The author saw PII being shouted in waiting rooms, documents left lying around or binned insecurely. These physical gaps can be just as damaging.
So joining up the digital and the physical.
Exactly. And maybe the most important gap, ground-level implementation.
Bridging that policy reality gap we talked about.
Yes. The strategy sets a good direction, but it needs much clearer, practical guidance for frontline staff on how to deal with those everyday system frustrations without resorting to risky workarounds like personal hotspots or shared logins.
How do you make security easy when someone's dealing with an emergency?
That's the challenge. Any solution has to recognize that patient care will always come first for staff. Security measures can't add significant friction or clinicians simply won't use them. They have to work with the workflow, not against it.
That tension is perfectly illustrated by the whole ransom payment issue, isn't it? The government has this official no ransom policy moving towards banning it for the public sector.
Right. The policy aim is clear. Don't reward the criminals, deter attacks.
But what happens when a hospital is crippled by ransomware right now? What's the reality on the ground?
Well, the reality is it's incredibly difficult. While officially no ransom is paid, there's speculation that sometimes organizations might quietly use intermediaries, specialist negotiators, to resolve the situation. Because the alternative, prolonged, catastrophic disruption to critical care, potentially costing lives, is unthinkable.
So policy says one thing. Operational necessity might force another.
It highlights that disconnect, and it really reinforces why prevention and having robust, tested recovery plans is so absolutely crucial. You want to avoid ever being in that impossible position in the first place.
So wrapping this up, what's the big takeaway? It feels like improving NHS cybersecurity isn't just a tech problem at all.
Not at all. It's deeply cultural. It's about processes, it's about funding, yes, but fundamentally it's about people, the staff under pressure, the patients needing care. It directly impacts safety, efficiency, and that crucial element of trust.
But the message is ultimately hopeful that these problems can be fixed.
Absolutely. The solutions are there. Many are outlined in the strategy and the author's analysis. But they'll only work if we fully acknowledge the operational realities, the human pressures, and design security around them, not just impose it on them. Which brings us to a final thought for you, the listener. Think about your own interactions with healthcare, the digital forms you fill, the apps you use, the data you share. What, from your perspective, would really make these systems feel safer and actually be easier to use, both for you and for the staff delivering that vital care? Is there something simple, something obvious perhaps, that could bridge that gap between policy and the daily grind?
Some important questions to ponder. Thank you for joining us on this deep dive into NHS cybersecurity. We really hope this discussion encourages more focus on these critical issues. Understanding them is definitely the first step towards building a safer, more secure healthcare future for all of us.